Bonjour, bienvenue à cette conférence de presse. My name is Guillaume Saint-Pierre from the Journal de Montréal. I'll be your moderator. With us today, Prime Minister Justin Trudeau, Ministre de la Santé Jean-Yves Duclos, Ministre Mary Ng, Trade Minister, Minister Tassi, Procurement. We will start with short remarks from the Prime Minister and Madame Ng, and then we will take questions for about 20 minutes from the Prime Minister, and then 15 minutes for the ministers. Monsieur Trudeau, à vous la parole.
Merci beaucoup.
Thank you very much. I'm very pleased to be here with you today, along with, indeed, Ministers Ng for a short present speech, and Ministers Tassi and Duclos to answer some of your questions. We are here today to talk to you about what we are doing to continue to support you and protect you during these difficult times.
We had our 36th First Ministers meeting since the beginning of this pandemic. It was an important and constructive conversation in which we came together to respond to this very difficult Omicron wave that is hitting across the country, particularly in terms of its impact on our healthcare workers and systems. We talked about vaccines, we talked about rapid tests, we talked about procurement of treatments and a number of other issues. We continue to work together across all orders of government to support Canadians, to support our health workers, and to make sure that our economy is able to come roaring back once this wave comes through. On vaccines and boosters, we now, as people know, have enough vaccine supply in this country to make sure that everyone can get fully vaccinated. We continue to bring in doses for any future needs that science and experts will dictate to us. We've advanced 1.8 million doses of Pfizer into January for a total of 6.8 million Pfizer doses in January for Canadians aged 12 and over. So it's really important that everyone get their booster when it's time for you to do so. We have more than 10 million boosters already administered across the country. So if you haven't, please go get your shot. It's never too late to do the right thing. And I can tell you that when you show up to get your very first shot in your local vaccine clinic or your pharmacy, the pharmacists, the healthcare workers will be incredibly pleased to be able to give you your first shot. It is about doing the right thing. They'd much rather be giving you an injection of a vaccine to keep you and everyone safe than having to deal with you in a critical care bed. Please, it's time to get vaccinated. It's time to get your boosters. We notice as well that only about 45% of Canadian kids between 5 and 12 years old have been vaccinated. With schools still virtual, but eventually in many places still virtual and in many places returning soon, we need to make sure that kids are getting vaccinated. Quand je suis parti ce matin,
when I left home this morning to get to this press conference, I went to check on my 3 kids. All 3 of them were in their individual rooms on their computers, on their iPads, doing virtual school. We know that it's going to come to an end soon. We want everyone to be vaccinated. Please encourage your friends, your neighbors to get vaccinated and to make sure their children are also vaccinated.
Vaccines work. They work to protect you. They work to protect the vulnerable people around you. They also work to support our frontline healthcare workers who are in danger of being overwhelmed by this Omicron wave. So we're not just supporting them, we're supporting the people who are at risk of seeing important surgeries and treatments canceled because our health systems are getting overrun. We need to continue to do what we know we can do. That is, stay safe, be careful in your gatherings, in your distancing, wear a mask, and yes, remember to continue to get vaccinated. On that, I want to thank once again our extraordinary frontline health workers and everyone working in public health for the incredible work they've done over the past 2 years. This pandemic is dragging on, and it's exhausting for everyone, but it's particularly difficult for those health workers who have been going flat out for the past 2 years to try and keep everyone safe, to try and get us through this. Please do everything we can to protect them. They deserve not just our thanks, our deepest gratitude, but our support. And that means getting the boosters, getting the vaccinations, getting our kids vaccinated so we can get through this. Je veux aussi parler du soutien.
I'd also like to discuss the support we continue to provide to our companies, to our businesses, to small businesses, and to our workers. The pandemic is not over. We continue to be here for Canadians as we promised from the start of the pandemic. There is support in case of a lockdown. There is the wage subsidy. I'll remind you that the wage subsidy is there to support you in keeping your employees, even if you are at reduced capacity. It's important to maintain that link with your employees. It's important to be able to give the employees an opportunity to continue to pay their rent, to put food on the table. But it's also important to make sure that we can come back as soon as possible, roaring back as soon as this wave is over. A fast recovery is important for the economic well-being of our entire country, so make good use of this wage subsidy. It's there for you. But small businesses also need more flexibility, and that is why today we will be announcing, or we are announcing, that we are extending the deadline to reimburse the emergency business account, the
subsidy. I want to remind employers that the wage subsidy is retroactive. So if you're making decisions right now about whether to keep people on through the coming weeks or not, know that that wage subsidy will be there to help you. We want to be able to have people continue to be tied to their jobs so that we can bounce back quicker once this wave is gone and we start reopening. People need the support to be able to keep food on the table. That's why that wage subsidy and the rent subsidy is there, offered by the federal government to help you make it through this difficult wave. We're also announcing today that we're extending the Canada Emergency Business Account, the CEBA, for eligible borrowers to the end of 2023. Minister Ng will have more details, but the bottom line is, of course, this. We will continue to be there to have people's backs with as much as it takes, with as long as it takes, until we get through this pandemic. I want to end today by speaking directly to kids once again. I know many of you are in virtual school again. Many of you have made more sacrifices over Christmas, over the holidays, not seeing your friends, not seeing your loved ones, having to hunker down, having to help out around the house as your parents are working virtually. This is not easy. And I know almost half of kids across this country have gotten their vaccine from ages 5 to 12. We need to get more. So please ask your parents if you can get vaccinated. Getting vaccinated protects yourself, protects your family, protects your grandparents, protects vulnerable people, but it also supports our frontline workers who are working incredibly hard, our nurses and doctors and people in hospitals who are dealing with a rise in cases. We know, kids across this country, you've been doing the right things over these past long years, and it sucks, but you've been amazing, and we need to keep doing everything we can to get through this. Je compte sur vous, je compte sur tout le monde.
I'm counting on you. I'm counting on all Canadians to continue to do the right thing, even if we're tired, even if we're done with it. We will continue to do the right thing to protect ourselves, to make sure that our country, our economy continues to operate, and that we will always be there for one another by doing the right thing. Thank you for your attention this morning. I'm now happy to hand over the floor to Minister Ng. Mary.
Merci, Premier Ministre. As workers and small businesses and people across the country face renewed uncertainty and with new lockdowns, rising case counts, and the Omicron variant, we continue to know that the best thing for our economy is to support our workers and businesses through this pandemic. I want to thank the millions of Canadians who have stepped up, who have made sacrifices and continue to follow public health measures, including getting their vaccines and their booster shots. And to Canadian small businesses, you have shown incredible resilience throughout this pandemic. And our government will continue to be there for you to support you as we have over the past 2 years. Supports including the Canada Emergency Wage Subsidy and rent subsidies, and now the lockdown program and the Canada Worker Lockdown Benefit. This has helped millions of businesses and workers across the country to get through this pandemic. I also want to take this opportunity to thank the 170 chambers of commerces, the boards of trades, and others across Canada for your help. You've helped to distribute millions of rapid tests from our government to small businesses and workplaces across Canada. Over 15 million tests have been provided to businesses across the country so far, with millions to come. Rapid tests are one of the many tools that we have to fight this pandemic and to support our businesses. Nous avons toujours dit que nous vous...
We always said that we would be there to bridge you.
Today, as the Prime Minister has already mentioned, in recognition of the challenges that many of our businesses are facing with these renewed lockdowns, we are extending the repayment deadline for the Canada Emergency Business Account Loans, or otherwise called CEBA, and also for the CEBA equivalent lending that is provided through the Regional Relief and Recovery Fund. We're going to extend to eligible borrowers. They will be able to have until December 31st of 2023 now to repay their loan. We've heard from businesses that they're looking for this flexibility, and that's what today's announcement is about. This additional year will help businesses get that flexibility and continue to work together through this pandemic to the end of this pandemic. I want everyone to know that we're going to continue to have your backs through this pandemic as we drive for a strong and inclusive and a sustainable economic recovery for everyone. Merci beaucoup.
So now we'll go to questions. So we only have 20 minutes. We have, I think, 5 questions in the room, starting with the mic to the left.
Good morning, Prime Minister. Good morning, Ministers. Thank you for taking our questions today. On the proposed issue of this tax or fee for the unvaccinated in Quebec, do you think, Prime Minister, this is the right or legal way to approach this problem? And is this something that you would consider looking at implementing federally?
Obviously, like people across the country, we've received that proposal with interest by the Quebec government, but there's a lot more details that we have to hear on how this would work before I can make any comments on it. But I will remind people that we have been clear at the federal level about how important it is to get vaccinated, and we brought in very strong measures to ensure that travelers across the country need to be fully vaccinated. People coming into the country need to be fully vaccinated, that the federal public service needs to be fully vaccinated. These are things that we have continued to move forward on because the best path forward is vaccination, which is why at the federal level, the fact that there is still a debate being brought forward by the Conservative Party saying that we need to be more accommodating of people who choose not to get vaccinated is, I think, exactly the wrong thing. Mr. O'Toole is out to try and protect his own leadership, and he's not thinking about protecting the healthcare workers who are on the front lines. We know very different jurisdictions are making different decisions about how to encourage people to get vaccinated, and as a federal government, we will be continuing to be there to support them in those decisions and to make sure that everyone gets vaccinated. Évidemment.
Of course, we're waiting for further details from the Quebec government on this issue. We are certainly here to continue to encourage people to get vaccinated. We know that in order to get through this pandemic, we will need a maximum number of people vaccinated. That is why we have taken measures to require mandatory vaccination for those who want to travel in the country, those who are public service workers, and we will continue to be there to ensure workers take these measures.
Mr. O'Toole, he says that you're incentivizing and normalizing lockdowns, and by demonizing the unvaccinated, you're pushing them further away from getting the shot. I'm wondering if you can comment a bit more on these allegations, and also whether or not you think that the government and you personally need to take another approach here when it comes to those who clearly, at this point in the pandemic, are not getting the shot.
We've continued to work in many, many different ways to encourage people to get vaccinated, whether it's public information campaigns, whether it's local and peer leadership to encourage people in different languages, in their communities to get vaccinated. We've continued to put forward strong incentives to be vaccinated. If you want to get on a plane, if you want to get on a train, if you want to travel internationally, these are the kinds of things that encourage people to get vaccinated. And I can tell you that there continue to be people showing up in vaccination clinics to get their first shots, including this week. This is something we will continue to encourage. Quite frankly, on the Conservative side, trying to pretend that rapid testing or testing in general is as good as getting vaccinated is simply irresponsible. Mr. O'Toole is more focused on appeasing the anti-vaxxers within his own caucus than he is on protecting Canadians, and certainly than on supporting frontline workers. If Mr. O'Toole was serious about being a leader to get Canadians through this pandemic, he would start by making sure that all of his MPs get vaccinated.
Abigail Beeman, Global News. Prime Minister, I hear you say that you're waiting for more details from Quebec before weighing in, but you've also highlighted the steps that you have taken federally in terms of unvaccinated people not being allowed to get on a plane or a train. So I'm wondering, how far are you willing to go at the federal level, and are you considering any mechanism of making an unvaccinated person pay for more healthcare or via tax, just the idea of it?
We've moved forward on some very strong incentives. If someone wants to get on a plane or get on a train, they now have to be vaccinated. There's no way around that. If you want to work for the federal public service, you need to be vaccinated. These are areas that are in control of the federal government, and these are measures that are strong that we've brought in, that the Conservative Party, for example, continues to disagree with, but we know that the vast majority of Canadians stand with. I continue to work with health experts to look at how we can encourage more and more people to get vaccinated, to get their boosters, to continue to get their kids vaccinated. But I will highlight that Canada is doing better than most countries around the world in terms of rates of vaccination. Canadians have continued to step up and do the right things, and it is something that I think we can all take pride in, the fact that Canadians have shown so unequivocally, for the most part, that we are there for each other. But I'm happy to turn it over to the Minister of Health, who is, of course, looking at more ways of encouraging Canadians to get vaccinated.
Yes, I agree entirely with what the Prime Minister said. First, we are waiting for details on the measure announced yesterday by the government of Quebec. Second, I exchanged with my colleagues over the last few weeks and just recently with the Quebec minister, and we are all on board when it comes to supporting universality of access to healthcare across Canada. This being said, we need to remind everyone, as the Prime Minister just said, that vaccination is the way out of this wave and out of the crisis in general. It works. You know, science has been telling us that for many, many months now, and we have demonstrated at the federal level that vaccine mandates also work. 99% of public servants, almost 99% of public servants at the federal level are either fully vaccinated or soon to be fully vaccinated. Let's remember that just a few months ago, there are some people in Canada, in other parties in particular, that doubted the ability and the willingness of public servants to get vaccinated, to protect themselves and to protect others. 99% have done that. Now, the same thing for RCMP, armed forces. We are mandating vaccination for all workers under federal regulation. That is almost 8% of total workers in Canada. We have, the Prime Minister said, we have mandated vaccination for transport by airplane or by train. We are using all the tools that we have at the federal level, not only to encourage more vaccination, but also to protect people. I would say that the key word here is benevolence. We need to look after each other, and we need to protect everyone from this terrible disease, which can be deadly, and that comes with vaccination.
Prime Minister, on booster rates in a number of provinces remain quite low compared to first and second doses, a number at or close to 30%. I'm wondering, with the information that you're getting, how much that is attributed to just the rollout process versus Canadians who don't, for whatever reason, want to get a booster dose, and if you're considering extending the measures you keep referencing in terms of planes and trains and federal workplace mandates to include a third dose as part of the definition.
Our decisions around vaccine mandates and requirements and what constitutes being fully vaccinated, those will be based on science, will be based on the recommendations of experts going forward. Right now, we continue to encourage Canadians to get their booster shots. Our job at the federal level is to make sure we're procuring enough vaccines so everyone can get the booster shots, can get their kids vaccinated. We have done that. And further, we're working to support provinces that need extra help on getting those boosters into arms. We've seen time and time again how Canadians have stepped up to be there for each other, to do the right thing, to protect their vulnerable loved ones, but also to protect our healthcare workers and our frontline workers. I know Canadians are continuing to do the right things because these booster shots will protect us and make sure that we can get back to the things we love even quicker.
Oui, bonjour, Monsieur Trudeau. Laurence Martin.
Laurence Martin from Radio-Canada. I understand you're expecting more details from Quebec, but on the principle, do you agree with the principle that the people that are not vaccinated be paying more for healthcare services? Answer, at the federal level, we have already brought forward measures that are harsh for people that are unvaccinated. The fact that they cannot travel by train or by plane, the fact they may lose their jobs if they work for the Canadian Public Service, if they choose not to get vaccinated. We have shown a rigorous approach, a firm approach on vaccines. At the same time, we know that various jurisdictions are looking at a number of measures that will also encourage people to get vaccinated. Of course, details are important when it comes to this Quebec proposal because we want to make sure that the Canada Health Act principles are upheld. As the Healthcare Minister just said, we know full well that Quebec also believes in the principles underpinning the Act, and we will be looking at the details to see how exactly that will transpire so we can continue to encourage the people and show people that are still reluctant to get vaccinated that the right thing to do is to get their shot. Question, do you agree with the principle? Do you think it's right to get the non-vaccinated to pay more? Answer, you also have to look at the incentives that will work for people. And the details really matter as to how things will work, what kind of an incentive it is, what kind of an encouragement it is, because that's why I can't tell you any more than that. And I can tell you, however, that we have taken extremely firm measures, really tough measures at the federal level to encourage, to in fact, make things difficult, make things a little more complicated for those who cannot travel by plane, by train, etc. These are the types of things that we need to make sure that people feel the urge to get vaccinated. We want to encourage them to do so, and we'll continue to do that. If I may? In English, and then I'll give you the floor.
As a country, different jurisdictions and the federal government have taken many strong measures to encourage Canadians to get vaccinated. And quite frankly, Canadians have stepped up themselves to one of the highest rates of vaccination in the world, because we know this is the way to get through it. And for people who continue to hesitate or to choose not to get vaccinated, they are losing privileges to do certain things, whether it's get on a train or a plane, whether it's travel internationally, whether it's move forward in a job in the public service, or even have a job in the public service. We have been taking strong measures from the very beginning. And yes, we know that there is continued debate on this. The Conservative Party of Canada continues to resist measures to encourage people to get vaccinated. They not even choosing to get vaccinated themselves. But at the federal level, we've taken some very strong measures. At the provincial levels, they're looking at measures that will work for them. This Quebec proposal is something that obviously everyone is paying attention to right now, but there are still many details to know. And the details will be important in how this works, how it balances the values and the rights that we all cherish as Canadians with the necessity of keeping people safe. Vaccines are about keeping Canadians safe, continuing to get through this pandemic the best possible way. And various orders of government are right to look at different ways of encouraging and incentivizing people to get vaccinated.
Ce que j'allais ajouter en français.
What I wanted to add in French, it supported what the Prime Minister was saying when he was saying that there are measures in place and that there is increased protection for people who are vaccinated. We know that since the summer, since the provinces and territories began requiring vaccines for people to go into gyms, to restaurants, to bars, and when the government at the same time also required vaccines, vaccine rates increased by 6 to 10%. That's what we're hearing from the estimates. So 6 to 10% more Canadians decided to get protected and to get vaccinated due to these vaccine mandates. So there are millions of Canadians who are now protected because they made the right decision. They got vaccinated given the impact of these measures. We're in a situation that is very complex now with Omicron, but could be even more complex if we had an additional 2 to 3 million Canadians who were not vaccinated today.
Kevin Gallagher, CTV National News. I'm asking a question on behalf of my colleague Avery Haynes with W5 for Prime Minister Justin Trudeau. On the issue of whistleblower protection, the Government Accountability Project in the United States says that you, Mr. Trudeau, have been the primary obstacle in blocking an overhaul of the laws protecting whistleblowers because of the scandals you have faced personally. What's your response to this?
As a government, we have consistently stood up for openness and transparency and brought forward reforms that have supported people coming forward to highlight wrongdoing in workplaces or institutions across the country. We will continue to do just that.
My follow-up question will be from me. You said that you need to hear the details. The details we do know is that in Quebec, there will be significant financial penalties for people who don't get vaccinated. Is that in itself a violation of the Canada Health Act? And would you consider clawing back healthcare transfers for that violation?
We're not going to descend into hypotheticals right now. We have been assured by the Quebec government that they intend to stand by the principles and the rules around the Canada Health Act as they move forward. So we continue to wait to look for details on this. But as we've said, incentives and strong measures, whether it's vaccine passports, whether it's requirements for travelers, whether it's the requirements for public servants to be fully vaccinated. We have taken very strong measures in the past, and they have worked in terms of keeping Canadians safe and getting Canadians vaccinated. We will continue to look and work with the provinces, look at measures put forward and work with the provinces and territories to do everything we can to continue to keep Canadians safe and get through this the best possible way we can.
Hi, Erica Ibrahim, the Canadian Press. Prime Minister, how can you justify promising to give Canadians fourth doses when many people in developing countries have not yet had a single dose? And is Canada applying the same pressure for manufacturers to deliver donated doses as it is for vaccines for our own use? And are you comfortable hoarding vaccines at the expense of less fortunate countries?
Let us be very clear. Canadians, and indeed the Canadian government, know full well that we don't end this pandemic anywhere until it ends everywhere. Omicron is an example of that, new variants can come anywhere out of the world and cause disruption everywhere around the world. That's why from the very beginning, Canada has stepped up with as a significant contributor to COVAX, to the ACT Accelerator. We've made commitments on donating tens of millions of doses, and indeed have flowed tens of millions of doses that we bought for Canadians to people around the world. We will continue to step up in ensuring that everyone around the world gets vaccinated, even as we make sure that we are able to keep Canadians safe. The two things aren't in opposition, they go together. Our responsibility as a government is to ensure that we have the procurement necessary if there is a need for future boosters or future doses. But in the meantime, we continue to work with the international community to make sure that we're stepping up on vaccinations around the world so we can end this pandemic around the world.
And my follow-up is, the Ukraine government would like to see Canada confirm its willingness to extend the NATO mission of 200 Canadian forces trainers beyond the end of March as a show of Canadian solidarity to the NATO alliance. President Zelensky asked you about this yesterday. Why can't the government make this small commitment to NATO's larger efforts in Eastern Europe?
I had an outstanding conversation with President Zelensky of Ukraine yesterday, reiterated Canada's long-standing support and friendship for Ukraine, condemned in no uncertain terms the Russian aggression and buildup of troops. We are all extremely concerned about that and are united as allies around the world in calling on Russia to de-escalate and indicating that there will be significant consequences in the form of sanctions if further aggressive actions are taken by Russia. We are proud that Canada is leading a NATO mission in the Baltic states, in Latvia. We are part of Operation Unifier on the ground in Ukraine, training Ukrainian soldiers. We will continue to be there to stand as part of our NATO allies with our friends in the region.
Last question in the room.
Fraser Needham from APTN National News. This question is for the Prime Minister as well. As you know, there's a major COVID outbreak going on in the Bearskin Lake First Nation in Northern Ontario. On December 30th, they made it pretty clear that they wanted military assistance to deal with the situation. They're doing various tasks. It took more than a week for the government to actually respond, and now what's happened is they've activated 4 local Canadian Rangers, which were already in the community. So saying that the military has been deployed is being a bit generous with the truth, I think. Do you think this is a sufficient response from your government?
I would actually refer you to Indigenous Services Minister Haidu's statement on this, which details the resources on the ground in Bearskin Lake, including Canadian Rangers, including workers who've been paid for by Indigenous services to come in from nearby communities, volunteers on the ground as well. Our response is extremely present in Bearskin Lake, and we're pleased to see the situation turning a corner and looking like it's getting better, but we will continue to be there in that community and in communities around the country as necessary.
Yeah, it's fair enough, and that's the response that we have gotten from emailed statements from Mr. Blair's office and also Patty Havey. But the reality is that people on the ground say that that is not the case. They feel that they've been let down by the government, that government has not responded in a way that they expected. They say the relationship is fractured. And one thing that is not really clear is why the government of Ontario actually has to make a request for the military to go in or to be deployed when it's actually, you know, that Ottawa deals directly with First Nations. It falls under federal jurisdiction. Are you going to maybe look into this maybe and sort of, you know, you said your government wants to avoid these types of red tape situations. It seems exactly what they're falling into. Are you going to look into this, maybe see if it could be handled in a more efficient manner?
I think it's important to remember that from the very beginning of this pandemic, the focus of this federal government was on ensuring that Indigenous communities, which we'd seen during previous pandemics like H1N1 are particularly vulnerable, which is why from March 2020 onwards, we gave particular focus and emphasis on supporting Indigenous communities through this difficult pandemic. We saw case numbers much lower in Indigenous communities through those first waves. We saw initiatives like the flowing of additional vaccines to Indigenous communities and northern and remote communities to be able to keep people safer quicker, were initiatives that all Canadians and indeed all premiers got behind to make sure we were supporting Indigenous people. Over the course of the past 2 years, we've continued to be there to respond as best we can to exigencies and emergencies, and we will continue to understand just how vulnerable Indigenous communities are to health challenges like this one, and we'll continue to work with them in the best possible way to keep their citizens safe.
Donc, on me dit qu'il nous reste un peu de temps pour aller au téléphone.
I hear there are maybe questions over the phone, operator?
Star 1, if you have a question, vous pouvez appuyer sur étoile 1 si vous avez une question. Première question au téléphone est de Marie Vastel Le Devoir. La parole est à vous.
Oui, bonjour.
Question, Mr. Trudeau, good day. I'd like to get back to the Legault's issue about healthcare contributions. I understand you don't want to speculate. From what I understand, Quebec has assured you that its measures would respect the Act, the Canada Health Act, but beyond that, do you think there could be some issues with respect to the rights aspect, or are you satisfied, as you said, at the federal level, given what the healthcare minister has just invited provinces to also mandate the vaccines? What would you say to that? Answer. I'm not sure I fully understand your question, Marie. Do you want me to answer it so that I don't waste it? Answer. I understand that Quebec assured you that they would uphold the Canada Health Act, but beyond that, do you think there might be some issues here when it comes to the rights of Quebecers or Canadians, or do you consider this in a positive light, given the fact that you have imposed vaccine mandates? Answer, the question is the same, actually. What we will always do is ensure that rights and fundamental values are upheld in our own proposals or in other governments' proposals. It always remains a concern for us. We will look into the details of the proposal to see exactly what they are proposing, to have a better idea of how that would work. I can tell you this. We had taken very tough measures to encourage people to get vaccinated. Provinces did the same. So there's no opposition when it comes to the government, to us taking strong measures. But we will always try to make sure that these measures are effective and also in respect of the Act, and that's why the details really matter. Question, there are many people in English-speaking Canada that are scandalized or actually quite emotional about the Quebec announcement. You visibly seem to be in agreement with the principle. You just confirmed that. Why do you refuse to openly go further? Why are you in some way hiding behind the fact that we don't have details yet or not enough? Why not be more clear as to your opinion? Unless you fear that the English-speaking Canada might not like it. Answer. I understand that it's easier to get a headline when you have a simplistic answer, but these are very complex issues, Marie. How to balance respecting fundamental rights and freedoms, the upholding of a fundamental act like the Canada Health Act, and at the same time, how do you strongly encourage people to continue to get vaccinated? These are concerns that we had when we advanced those measures requiring vaccinations for air travelers, for instance, when we required that Canada's public service be vaccinated as well. details matter. We need to know exactly what measures we're putting forward, and there's a lot of work that needs to be done there. It's not to avoid answering a question. It's to say, really, we need to know what the terms and conditions of this proposal entail, so we can know that it will be effective, that it will do the right thing, that it would be that it will reflect our values and principles. This is all the time we have. The Prime Minister. Ministers will remain for another 15 minutes. I'd like to give our friends over the phone an opportunity to ask some questions, so let's get a few questions over the phone.
Opérateur.
Operator.
Thank you, merci. The next question is from Ryan Tumulty from the National Post. Please go ahead.
Yeah, hi there.
I think you're...
I'm sorry, we cannot hear you.
Can you hear me now?
Yes.
I wanted to ask you about the antiviral treatments from Pfizer and Merck, as well as the Novavax vaccine, all of which are awaiting approval from Health Canada. I'm wondering if you can give us any kind of timeline on those, as well as, say, if the same number of resources are available to review the data from those companies as was available to approve the Pfizer and Moderna vaccines.
Thank you very much. So first on the antiviral treatments, the Health Canada's approval process is proceeding swiftly in an accelerated manner, has been the case for many other approval processes over the last 22 months. They are obviously working with international partners on making sure that this is moving swiftly and efficiently. The announcement, the decision will be made very soon. As we prepare for that decision, whatever it may be, we have already secured 1 million doses of treatments of Pfizer, which is equivalent to 10 million doses, because these treatments come each with 10 doses. So 1 million such treatments already procured with a contract that Minister Tassi generated and approved just a few weeks ago. And what we're doing in parallel with that is to work with provinces and territories. I've had several discussions with my provincial and territorial health colleagues over the last few weeks in making sure that when and if that treatment by Pfizer is approved, we are able to move swiftly to clinical use of that treatment across Canada. Now, on Novavax and other vaccines, and as you know, there are several others that we have contracts with. I will just say that Health Canada does the work that it does, which is to proceed with a swift, efficient, but a rigorous assessment of both the efficacy and the safety of the vaccines.
Follow up, Ryan?
Yeah, Minister, earlier in this press conference, you said, that vaccine mandates work, which is why the federal government approved them. I'm wondering if you think what Quebec has announced here is essentially a vaccine mandate, just perhaps a more aggressive one, and if you feel that it could drive up vaccination as well, and thus is worth considering.
Well, thank you. First on vaccine mandates, the key word here is benevolence. Both the language and the actions are there and designed to protect people. This is a severe disease. We want people to be protected against it. And as they protect themselves against the disease, they also protect others, either in their living or their workplaces. No one, I believe, is thinking or certainly speaking of forcibly physically vaccinating people in Canada. What we have done at the federal level is to put into place vaccine mandates that do work around borders, around transportation, air and train, around the workplaces, federal public service, the RCMP, the armed forces. That works. It protects workers. It protects those around them. It increases vaccination as well. As I mentioned earlier, possibly by between 6 and 10% more than we would have had without vaccine mandates, in addition to what provinces and territories have sometimes already started to do, and using passports, vaccine passports, and vaccine mandates associated to those vaccine passports. What I was saying last Friday is that I think this conversation will proceed even further in the days and weeks to come as we do everything we need to do, using all the tools that we have in our toolbox to go through this wave and make sure that we are better prepared and more prepared, and prepared as much as possible with any possible future waves and any future possible variants. Now, on Quebec's announcement yesterday, the Prime Minister said clearly, A, we don't have details, B, we all agree that the principles of the Healthcare Act, in particular the principle of universality of access, these principles, we all agree, both at the federal and provincial level, that they must be bidden, they must be enforced. And third, we must use all of our tools again in our toolbox to increase vaccination so that everyone is protected against the disease.
Operator.
La prochaine question de Hélène Buzetti, les coop de l'information. La parole est à vous.
Question for you, Mr. Duclos. You're saying that at the federal level, it really matters to use these vaccine mandates in many regards. I'm wondering why in this situation one wouldn't look into these federal public services statements about their vaccination to make sure that they are indeed vaccinated. What about that $500 per week? Would that still be given to people who are not vaccinated? Answer, look, you had a few questions there. I'll try to answer as well as I can. As to the issue of mandatory vaccination, the main issue is benevolence, the key word. That's sort of our approach at the federal level. We want to protect Canadians. We want to make sure that people don't end up sick with COVID-19. Nobody wants anyone to end up in intensive care with COVID-19. So it's out of this approach of goodwill and benevolence. Now, with respect to the public service, most public servants are either completely vaccinated or about to be. That shows to what extent they are concerned and are actually acting in order to protect themselves and their colleagues. Now, with respect to detailed verifications of their claims that they're vaccinated, that is done by managers within the public service. It is done in a both respectful and effective way. Now, with respect to support measures for workers, there is again this concern to do the right thing and also be rigorous. These benefits need to be allocated not only to take care of other people, but also to take care of people who do the right thing. In other words, if someone loses his job or her job when the job requires mandatory vaccination, well, that person is making a choice. If that choice is guided by other motives rather than medical reasons, then some benefits are no longer going to be available. Question, I'm not sure you understood my question. I was wondering whether the sickness benefit could be conditional on vaccination.
I don't know if you're still there. It's about the vaccination mandate for truckers that's coming into force this Saturday. The trucking industry says that it could lead to the loss of up to 15,000 truckers, and that could have a major impact on supply in Canada. So I'm just wondering whether or not you're considering postponing that measure.
Je peux répondre rapidement sur la première question.
I can answer quickly on the first question. Of course, you'd need to ask Minister Qualtrough about these issues because she's responsible for this file, and she could tell you what could or could not be done in the future.
Mary, do you have a question on the border measures that will take place, in fact, quite soon on Saturday?
Yeah, I would say that thank you very much, Minister Duclos. I just want to assure Canadians that we've been working very, very hard to ensure that supply chains continue to flow. Of course, I continue to work with my colleagues in transportation and others to ensure that that just as we have throughout this pandemic, that supply chains continue to be resilient. But, you know, what is top of priority for all of us, of course, is making sure that the health and safety of Canadians are, are looked after. And that is what vaccines are about. And that is why we are continuing to encourage everyone to get their vaccines and everyone to get their boosters. But certainly the issue of making sure that supply chains continue to move and that they remain resilient is work that we are continuing to monitor.
Last one on the phone.
The next question is from Marika Walsh from the Globe and Mail. Please go ahead.
Thank you. My questions are for Minister Ng. The CFIB had asked for the CEBA repayment to be extended until the end of 2024. Why is the government only giving an extension until the end of 2023?
Marika, thank you very much for that question. Happy New Year's. I think this is the first time that you and I are speaking. Today's announcement to extend the CEBA loan, which will, of course, then give businesses the flexibility to also to receive the forgiveness portion of the loan. I'll remind Canadians that the loans of $40,000 or those that receive the $60,000, there is a portion of that is forgivable, and forgivable if you're able to repay your loans originally by the end of 2022. Extended to 2023 will give businesses that flexibility in order to manage their cash flows. Almost 900,000 businesses have had this loan, do have this loan, and we're pleased that we are able to provide that flexibility. But I want to assure Canadian businesses, we've had your backs from day one. We're going to continue to do that. We want to make sure that we continue to work together so that we can get through this pandemic. And today's announcement is very much in keeping with that.
Okay. I understand that you're extending it to 2023. I'm not sure I'm not understood. I heard an answer as to why it's not going further. I also, though, want to ask why there's no sort of sliding scale or accommodations based on hard-hit sectors, because we know that some businesses have ended up doing very well in the pandemic and have benefited from this loan, while other businesses are having a much more difficult time. So why not add in a needs assessment, for example, on the repayment deadline, or on even how much businesses might get with a potential new top-up or something this year, given the current situation?
Well, America, this is exactly what we did and anticipated well before even Omicron hit. You'll remember that before before the end of 2021, we passed C2. There are provisions in there that are supporting businesses and particularly those hard-hit businesses, the hardest hit businesses, and those in sectors like tourism. We continue to be there, and in fact, those supports that are there, particularly for the hardest hit businesses, continue to be there in recognition that many businesses, certainly before Omicron hit, were well on their way to recovery. I mean, we've recovered all of the jobs that we saw lost during COVID-19. That is progress. However, anticipating and to be prepared, as we are seeing now through Omicron, that there are lockdowns and that we still have to manage our way out of this pandemic. That's why we put forward the provisions that we did before we rose before Omicron, and now those lockdown supports are there for businesses. They're there for workers. There's certainly supports for the hardest hit businesses. And today, with the extension of CEBA, that is going to give the flexibility to those businesses who have asked us for it. And we have right from the beginning been working with businesses on the ground, listening very intently. And you've seen us throughout the course of this pandemic to adjust as we needed to in response to businesses. And we're going to continue doing that work. We've got their back, we've had their backs, and we'll continue to do that as we finish, as we keep fighting this pandemic.
So we'll now turn to the room. Mike to the right.
Kevin Gallagher, CTV National News. My question's for the Minister of Procurement, Filomena Tassi. Listen, today the Dina Hinshaw, actually recently I should say, tweeted, Alberta has learned that the expected supply of at-home rapid tests has been delayed from the federal government and manufacturers. So I just want to know what the nature of that delay is that Dr. Hinshaw is talking about, and are there supply chain issues affecting some of the delivery and procurement of rapid tests?
Well, thank you very much for the question. I would begin by saying that, the demand for rapid test has escalated, particularly in the month of December. So prior to December, at the end of December, we had 120 million rapid tests procured and delivered. You have heard the Prime Minister say that the month of January, we are distributing 140 million rapid tests to provinces and territories. And this is extremely important because we know that this is another tool that is available to provinces and territories. Up until the beginning of January, we had procured and delivered every test that provinces and territories were asking for. Of course, with the onset of Omicron in December, those requests escalated. We are in the process of doing everything we can to secure as many rapid tests as possible because we know this is a very valuable tool for provinces and territories. I will say that we currently have 14 suppliers. I have been in contact with a couple of those suppliers. My team is in regular contact, and this is a very competitive market, and there are issues with respect to the supply chain. And those deal with issues of labor, issues of accessing raw materials, and also the cargo planes and getting the transportation. So what I would say is, I'm not going to undermine the fact that this is a very competitive market. We are doing absolutely everything we can to procure as many tests as possible. We have been very successful to date, and we're going to continue to work with suppliers to ensure if there are things, logistics, that we can assist as a federal government, we are there to help those suppliers every step of the way. To date, in total, we have procured over 426 million rapid tests, and we're going to continue to get those to provinces and territories as quickly as we can.
So we have about 5 minutes left, so if we can just make it short. Great.
It's Travis Janish from CBC. My question is for Minister Tassi as well. Canada's original contract with Pfizer was for up to 76 million doses. Posted figures show 51.3 million doses of Pfizer distributed across the country, and apparently what's left now is about 2.9 million. So I'm just wondering about the gap of 25 million, and did Canada opt not to buy its full contracted amount with Pfizer?
No, to date, we have continued with our contract with Pfizer and received the doses to which we were entitled to. In fact, as the Prime Minister mentioned, we accelerated doses of Pfizer by 1.8 million this month. They were able to do that for us. And so this month we are going to be receiving 20.2 million boosters in January. 6.8 million of those boosters will be coming from Pfizer. We also have 35 million doses for 2022 that we have procured, with options to purchase another 30 million. So our relationship with Pfizer is strong. We are receiving the doses to which we are entitled. And we are going to continue to work. They're an excellent partner, and we're going to continue to work them to secure the doses that we need.
Beaman, Global News. My question is for Minister Duclos. On the PCR tests upon arrival, given the strain on PCR testing in the country and symptomatic people who can't get a PCR test, I'm wondering if there are discussions underway to drop the arrival requirement, given those people have already taken a test within 72 hours, and if there are discussions underway on the other side about dropping the move to make everybody get a test upon arrival, since I understand that's not yet currently happening.
Okay, thank you. So a number of questions. I'll try to be fair and useful. First, on the actual crisis, not crisis, but yeah, I think it's a crisis, the actual access to PCR testing across Canada. So we know that provinces and territories are challenged when it comes to having sufficient PCR tests, and that's why rapid tests, to which Minister Tassi just spoke, that's going to be, in addition, one more tool for them to use in their toolbox. When it comes to border testing, it's both about responsibility and resources. We have the responsibility to make sure that there is as little importation as possible of COVID-19 and Omicron cases across the border. This is federal responsibility, and we are on top of that responsibility. There are obviously resources that we're using, but these resources are separate from, and both separate in terms of quantities and partners, but also of, obviously because of geographical locations. So these resources are used separately from the resources to which provinces and territories have access through their own networks. Now, when it comes to other ways of adjusting to the crisis, as the crisis evolves, we'll obviously do that, and we'll follow the situation and adjust our border measures and other measures as the situation changes.
Petite dernière en français.
Oui, bonjour, Monsieur Duclos, Laurence Martin, Radio-Canada.
Question from Radio-Canada. Do you think a healthcare contribution could urge people that are not vaccinated to get vaccinated? I think that's a question you're going to want to ask of the Quebec government and other provinces and territories that are already considering or will consider in the future measures. Again, keeping in mind this concept that I mentioned of benevolence, I think it's important to speak in a kind way of these issues. These are very delicate matters. It's important to have these conversations. We would all prefer COVID never to have happened, never for it to end soon, but we know that this is an ongoing issue. We will continue to have an ongoing benevolent conversation about this, and that's what I said a few moments ago, and that's again what I'm hearing also from the provinces and territories. They want to go ahead in this way to increase the number of people getting vaccinated for them to protect themselves and protect the people around them. And the way of doing that, it really depends on them. That is the provinces and territories. It's up to them to discuss that. Inaudible question. Answer. What I can tell you on the basis of information we now have, based on the impact of the vaccine mandates we've had in place since last summer and the impact of the vaccine mandates the provinces and territories have implemented, we know that they could be extended, but with respect to what we've seen over the last few months, experts believe that we've increased vaccination by 6 to 10% rates of vaccination. So this is just for Quebec here. This is an increase of the number of vaccinated people by 10%. We're talking about 700,000 further Quebecers who are now protected from COVID-19 and Omicron specifically. We're talking about 10% of the unvaccinated causing 90% of the costs. Imagine if you had added another 10% of the population that was not vaccinated. That's what we would be dealing with if the vaccine mandates we've implemented federally and elsewhere over the last few months had not been implemented. This ends our press conference today. Thank you very much.